They paged me for a psych evaluation. The patient was acting erratic. But the brain doesn't just break for no reason, Levies. This wasn't a mental breakdown. It was a biological invasion. Hello, Levies. Welcome to the Patient Files. Today's case is what we call a mimic, a disease that disguises itself as something else entirely and nearly fools everyone in the room. This is case number 001, the mimic.
The following case is a work of fiction. The patients, the names, and the events depicted are entirely invented, created for the purpose of storytelling. However, the medicine is real. Every diagnosis, every clinical sign, and every treatment you are about to hear has been researched from peer-reviewed medical literature, published case reports, and credible academic sources by Dr. Karma herself. The mind, the pen, and the passion behind every case in this series. No artificial intelligence was used in the creation of this content. Only her knowledge, her research, and her craft. What follows is fiction. What it's built on is not. Now, let's look at the charts.
The patient was a 20-year-old female medical student. She was brought in confused, stumbling, shouting at the walls. The nurses had already made up their minds. Long shifts, burnout, stress-induced breakdown. They were ready to sedate her and transfer her to the psych ward. And honestly, on the surface it was a reasonable call. Psychiatric symptoms are the first thing Wilson's disease shows the world in nearly 30% of cases, and they look exactly like a mental health crisis. But I wasn't ready to sign off on that yet. I watched her for 2 minutes before I touched a chart, and I noticed things. Her hands weren't just shaking, they had a rhythmic, dystonic quality. That's not anxiety tremor, that's a movement disorder. Then I looked at her eyes, and there it was, a faint golden brown ring around the outer edge of her irises. So faint you'd miss it if you weren't looking. That's called a Kaiser-Fleischer ring, copper depositing in the cornea. Stress doesn't do that. Burnout doesn't do that. Then I pressed on her abdomen and she winced. Her skin had the faintest yellow tinge, jaundice. Her liver was involved too. I stopped the sedation order immediately. I ordered a serum Ceruloplasmin. That's the protein that carries copper through the blood. In Wilson's disease, it drops critically low because the body can't process copper correctly. Hers came back at 0.08 grams per liter. Normal is above 0.20. I followed it with a 24-hour urine copper test, which came back sky high. Then I sent her for a slit-lamp exam, which confirmed those Kaiser-Fleischer rings bilaterally. The diagnosis: Wilson's disease, a rare autosomal recessive genetic disorder caused by a mutation in the ATP7B gene. Her body had been accumulating copper in her liver and brain for years. It has been called the Great Masquerader, capable of mimicking everything from schizophrenia to bipolar disorder to personality changes. She didn't need a psychiatrist. She needed a chelating agent, a drug that binds to excess copper and pulls it out of the body through urine. We started her on D-penicillamine and Zinc supplementation immediately and brought in a hepatologist for her liver involvement. With proper treatment, the cognitive and behavioral symptoms can reverse, and hers did. Within 48 hours, the confusion lifted. Within a week, she was having full conversations. She wasn't erratic. She wasn't breaking down. She was sick. And nobody looked close enough until we did. She's back in medical school now, and I have a feeling she's going to be the kind of doctor who always checks the eyes. The lesson from case number 001: psychiatric symptoms always deserve a medical workup first. Organic causes, meaning physical, biological causes, must be ruled out before you put someone in the psych ward. Always check the eyes, always check the liver, and never let a convenient explanation stop you from asking one more question. P.S. Note: Wilson's disease is real, documented, and tragically underdiagnosed. The average delay from first psychiatric symptoms to correct diagnosis? Over 2 years. Stay curious, stay thorough. I love you, lovies. Dr. Karma off duty for now.